This is Kathy Knipfer, nursing instructor for Nursing 2333, recording the Managing Nursing Care lecture for Chapter 13 on care delivery strategies. Model selection. When selecting a model of care, the organizational mission and purpose, the unit objectives, patient population, staff availability, and economic feasibility should be considered. Care models include the case method, functional nursing, team nursing, primary nursing, as well as case management. With case management, questions to ask would be, where does case management take place? What are the standards of practice for case managers? And what are the critical pathways? Now we'll discuss emerging practice models or influences. One is the magnet recognition that started in 1990 by the ANCC. This recognition recognizes excellence in the nurse's work environment. The hospital would make an application and complete a rigorous self-appraisal evaluating the forces of magnetism, and it's awarded for 4 years. The synergy model was developed by the AACN. With the clinical nurse leader model, this person must pass the clinical nurse leader certification exam and is an advanced generalist. They're not an advanced practice nurse, but they have a master's degree. And you can refer to box 13-1. The clinical nurse leader oversees lateral integration of care for a distinct group of patients. This person may be actively involved by providing direct care for complex patients. According to the Magnet Recognition Program, characteristics of a healthy, productive clinical environment include working with clinical and competent peers, collegial, collaborative nurse-physician relationships, clinical autonomy, support for education, control of nursing practice, as well as transmission and adoption of patient-centered culture. With the synergy model, the framework for nursing practice involves matching patient characteristics and nursing competencies to achieve better outcomes. Patient characteristics include resiliency, vulnerability, stability, complexity, resource availability, participation in care, participation in decision making, and predictability. Nurse competencies include clinical judgment, advocacy, and moral agency, caring practices, facilitation of learning, collaboration, systems thinking, response to diversity, and clinical requirement. The premise for the case method care delivery model is that one nurse provides total care for one patient during the entire work period. So there's one nurse for 8 hours, and another nurse for 8 hours, and another nurse for the other 8 hours in a 24-hour period. Let's review the role of the nurse manager when using the case method of delivery. The manager must consider the expense of the system. So the nurse manager assesses patient needs to determine the level of care. Care may be provided by the RN or care may be supervised by the RN. So the nurse manager needs to hire and manage the staff to provide total care in a cost-effective manner. The functional model of nursing is a method of providing patient care by which each licensed and unlicensed staff member performs specific tasks for a large group of patients. The LPN or LVN may give oral medications. The RN may do all the admissions and treatments or all the IV medications. The nurse aide or the UAP may do all the vital signs or do all the hygiene supplies. And they all would report to the charge nurse. Advantages of functional nursing are that it's efficient. Assistive personnel such as nurse aides and UAPs can be trained to perform specific tasks, and it's cost effective. Disadvantages of the functional model of nursing include fragmented care, orientation to a single task, patient and family needs may be overlooked, there could be lapses in communication, quality of care may be compromised, the holistic view of a patient and their family may be lacking, and it may be frustrating to the professional nurse. Because the functional model of nursing received criticism, a new system developed called team nursing. It was devised to improve patient satisfaction. In team nursing, a team leader, who is a registered nurse, is responsible for coordinating the care by a group of licensed or unlicensed personnel, and this would be for a small group of patients. The team leader should be highly skilled, a manager and practitioner who assigns each member specific responsibilities according to role, licensure, education, ability, competency, and the complexity of the care required. The members of the team, such as the RN, LPN, LVN, nurse aide, or UAP, report directly to the team leader regarding patient progress, and then the team leader reports to the charge nurse. Advantages of team nursing are that it is cost effective and that decisions are made at the grassroots level, often by staff caring for the patient, and there is improved patient satisfaction. Disadvantages of team nursing are that a skilled, knowledgeable team leader is needed. Also, adequate staff are needed with the right skill mix. There is a potential for fragmentation of care. Few work settings implement team nursing as originally designed. The team leader plans the care, delegates the work, and follows up with members to evaluate the quality of care for the patients. In the ideal circumstance, the team leader updates the nursing care plans and facilitates patient care conferences. The team leader also has many challenges. There may be changing team membership on a daily basis, diverse work schedules, and nursing staff shortages. The team leader must be knowledgeable about the legal and organizational limits of each role. Primary nursing is an adaptation of the case method or total patient care method. It's a method for organizing patient care delivery in which one RN functions autonomously as the patient's primary nurse throughout the hospital stay. The primary nurse collaborates, communicates, and coordinates all aspects of the patient's care with other nurses as well as other disciplines. So the primary nurse communicates with supervisors, consults with physicians and other healthcare providers, and also with associates that work different shifts. The advantages of primary nursing are increased communication with physicians and other healthcare providers, autonomy, increased patient rapport, motivation, working with professional staff, and holistic care. Disadvantages include that it's costly for the agency. The RN may not want 24-hour responsibility. The RN may be inexperienced and lack autonomy. Now let's look at the primary nursing hybrids. There's the partnership model and the patient-focused care model. In the practice partnership model, an RN is paired with a technical assistant, and that assistant works with that RN consistently. When the partner is unlicensed, the RN allows the assistant to perform basic nursing functions that are consistent with the state delegation rules. This frees up the RN to provide semi-primary care to assigned patients. A partnership also may be formed between the RN and the LPN or LVN. Patient-focused care is focused on improving patient satisfaction as well as worker satisfaction, and also focuses on efficiencies and decreasing costs. In addition to improving worker satisfaction and patient satisfaction and increasing the efficiencies and decreasing costs, patient-focused care is decentralized and streamlined and localized. It includes a multidisciplinary team that formulates the plan of care after the primary nurse and physician assess the patient. This also includes team members that provide direct care activities. Differentiated practice is based on education and experience. Nursing case management is the process of providing comprehensive care for those with complex healthcare problems. Goals would be to improve patient outcomes, to decrease the hospital length of stay. The case manager interfaces with multiple disciplines. Care is provided across the continuum of illness, often in different institutions. Case managers often work in different specialty areas. There may be a medical case manager, a pediatric case manager, an OB case manager, and even a trauma case manager. And they would care for those respective patients. Nurse case managers coordinate patient care throughout the admission process. They facilitate access to needed health resources. They monitor utilization of resources and measure outcomes and quality. They use critical pathways or care maps. Another role that a nurse can hold is that of nurse navigator. The nurse navigator seeks timely and efficient care for patients for a defined set of health services. They help to remove barriers to care, usually for individual patients, and they're focused on a single health condition. Some questions that I would like for you to think about and answer regarding critical pathways and care maps are: how are critical pathways and care maps developed? And why are they used by the nursing care manager? How is evidence-based practice incorporated into these tools? Let's look a little bit more at differentiated nursing practice. It's defined or differentiated by level of education, expected clinical skills or competencies, job descriptions, pay scales, and participation in decision making. So there's the Associate Degree in Nursing, or ADN, the Bachelor of Science Degree in Nursing, or BSN, the Master of Science Degree in Nursing, which would be an MS or MSN, and they can be an Advanced Generalist or Advanced Practice Registered Nurse, an APRN. Let's also look at the nurse manager or leader role in differentiated nursing practice. They must be a role model, a collaborator, a coach, a teacher, and a facilitator. What theory of leadership does this represent? Transitional care is important to avoid readmission. It involves comprehensive discharge planning. It includes instruction about medications and warning signs of health problems. It addresses contact with a provider following discharge. It emphasizes helping patients manage medications, and it also provides assistance with communication between the patient and primary and specialty caregivers.